Hi, it's exciting to be here at this first day of PVI, a vibrant, crowded sessions today. My name is Musialek. I am from Krakow in Poland. I am an angiologist and interventional cardiologist. And it's great to be here as part of multi-specialty vascular community, exchanging the best they can offer to each other. The topic of my presentation today was why we have changed the concept of carotid artery stenting by performing rigorous preparation of the lesion, pre-dilation, and also post-dilatation of the lesion to optimize the effect of carotid artery stenting for full endovascular reconstruction. The reason you do it is to achieve an excellent result of your procedure that is now feasible with plaque sequestration with micro-net covered stent. That stent allows you to completely optimize the vessel after the procedure and remove the problem of the plaque from the equation of intra, but also post-procedural complications in those patients. What this allows is, as the data show from our Paradigm 500 study, with now 5-year follow-up of the patients, is reduction of in-stent restenosis to less than 0.5% and total elimination of stent thrombosis that we know has been a concern with first-generation carotid artery stenting.